If you click this video away, then please tell me the reason for it so that I can improve. Otherwise, hi and welcome. I'm trying to learn medicine today, Atheroma, and after we've done it, we're gonna do arm strength training. And if you participate in the arm strength training, then it's at your own risk. And we're talking here about the blood system and diseases and internal anatomy. And this is no medical advice. I'm just reading it and trying to understand it. And this is the second part, I think. So we're going to go now over text and gather information together, and then we try to make a presentation about it out of memory. Atheroma. Atheroma is a degeneration of the walls of the arteries. The condition is also known as atherosclerosis and arteriosclerosis. Fatty deposits develop on the artery walls, which then harden, producing the condition known as sclerosis. The deposits enlarge into plaques. These are raised circular areas, which together with the sclerosis lead to narrowing of the artery. So the fatty deposits are there, and that causes to harden of the artery, called sclerosis, and also are these fatty deposits getting bigger and causing plaque, and not only are they now hardened, but also narrowed through the plaque. Arterial thrombosis, clotting of the blood, may occur at any site where plaque occurs. Previously, arterial thrombosis, clotting of the blood in a short segment of an artery which completely obstructs the normal flow of the blood. Heart, brain and leg arteries are the most commonly affected, but any artery can be affected. And it can lead to an arterial thrombosis. That means there's in that area no blood flowing anymore. It can be to a leg, an arm, to heart, brain and leg. Most to the leg, to the heart or to the brain. Atheroma begins in early adult life. Is it possible to get rid of it again? It begins in early adult life and increases with age. It affects almost everyone in the West to some degree, everybody. And with thrombosis, its chief complication, it is the main cause of heart disease and strokes. So I think the thrombosis will mean through the arterial thrombosis caused through the atheroma. Atheroma causes no symptoms until it reaches the stage when the narrowing of an artery interferes with the circulation of the blood. Then any of the following symptoms may occur depending on the part of the body that is affected. Symptoms caused by narrowing of the artery. When the heart is affected, chest pain on exertion, which is relieved by rest. So, angina pectoralis. When the brain is affected, temporary disturbances of balance, vision, speech, and use of arms and legs. And when does that happen? The temporary disturbance. What triggers this temporary disturbance? See transient ischemic attacks, intermittent claudication. When the legs are infected, pain in the calves when walking, which is relieved by rest. Okay, when the heart is affected, then chest pain, angina pectoris, pain in the chest. If the brain is affected, temporary disturbances of balance, vision, speech, use of arms and legs. Balance, vision, speech. Pain in calves can be when the legs are affected, which is relieved through resting. That is narrowing of an artery. And through a blocked artery, by the heart affected, sudden onset of severe pains in the chest, which persists, so technically chest pain, but it is stronger and suddenly and persists. The pain may occur during rest, and also during rest. Weakness or loss of use in arms and legs, speech difficulties, sometimes unconsciousness. No, I think it's more or less all those more or less together. In the legs, usually sudden onset of severe pain in the affected limb which goes cold and turns pale. Okay, if it is narrowed, then it was the chest pain, the angina, and the disturbance of vision, balance and speech, and also of the use of arms and legs, and then the pain in the claudications or pain in the calves gets better than people rest. If it is actually blocked, then sudden onset of severe pain in the chest, with the heart, and pain also during rest, brain affected, weakness, loss of use, speech difficulties, unconsciousness sometimes also. And by legs, sudden onset of severe pain, which goes cold and turns pale. Sudden onset of severe pain, pale and cold. Causes. A cause is not definitely known, but diet is believed to be largely responsible. When to consult the doctor. If any of the described symptoms occur, if there is doubt about whether exercise to help prevent atheroma can be taken, what the doctor might do. He or she will examine you to discover which artery is causing symptoms and whether it is narrowed or completely blocked. Perform a number of examinations, blood tests and x-rays to assess the severity of atheroma and other arteries. If an artery is completely blocked, an operation may be necessary to remove the blocked portion and replace it with part of a healthy artery from elsewhere in the body. Okay, removing and then replacing for a healthy artery, maybe from somewhere else of the body. Arteries other than those treated are likely to be diseased, though they may not yet be causing symptoms. To prevent the condition worsening, the doctor will suggest the general preventive measures which are described below. He or she may test the blood in order to estimate the level of fat it contains. Okay, blood tests look how much fat, also x-rays affect then replacing them with another artery, and the other ones are also probably also affected. Prevention. Stop or never start to smoke. This is the most important of all preventive measures. Exercise regularly throughout life, at least twice a week. Exercise should be strenuous enough to leave you out of breath and quicken your pulse, but if exercise is resumed in middle age after years of inactivity, there should be several months gradual build-up to strenuous activity. In any event, you should consult your doctor before undertaking any exercise. Avoid overeating. Part of any excess food that is eaten is deposited as fat in the arteries. I have a little wondering, We did gastroenterology in another series, the art of medicine. There was said that the blood system is taking the minerals, the amino acids, and vitamins, and the fats are taken by the lectorals inside the villi of a small intestine. So how do come now fat deposits into the arteries, into the blood? So they have to come in the second round, because they're not taken in through the bloodstream like the sugar, the carbohydrate, and so on. They're coming from the lectorals to the... I don't know where they go. That wasn't said where they go. No. How do we come into the blood system? So it has to be logically, actually, excessively, and not on their way. But I don't know. I'm just wondering about it a little bit. How does it now end up in the bloodstream? Because it's not taken inside the small intestine into the blood vessels, into the blood capillaries, but into the lectorals. Avoid overeating. Part of any excess food that is eaten is deposited as fat in the arteries. A person can be certain of not overeating only if he or she maintains an ideal weight for their height and also their sex. Keep to a good diet by following the recommendations below. Outlook. The prospects for those with a specific disorder caused by atheroma are given in the entry on the disorder. See page 81. Oh, there was symptoms. Okay, to avoid overeating, and also on top of it, something considered as a good diet. Okay, not smoking, exercising, not overeating, and trying to eat. This thing a bit to pay for it. It's a bit too much. And so basically what we're saying is not too much sugar. Try to eat fresh food. And also we're talking about white flour. Not white flour, but rather wholemeal flour for bread. and also a bit about what type of meat or something. So these types of stuff, so I was saying, but they're not really here for that. Okay, do we know it? Do we know it? The symptoms? The symptoms were the heart affected, it was chest pain, and when the leg affected, when stopping and by exercising and when the got pain. When the brain was affected, when disturbance of vision, speech and balance. If it is blocked, then it was sudden onset of pain in the chest, and also pale and pain in the leg, pale leg and sudden onset of severe pain in the leg, speech difficulties, weakness, pain during rest. Then the thing with the diet and its blood there, it can lead to hardening, which is called sclerosis. I won't have time to do the presentation now. Examinations, and then the four things, which is actually not that much. And the plaques can enlarge and that can cause nervous. And where the plaques are, it can happen after thrombosis. As soon as it's bigger, it can reach problems. I totally forgot what type of sport we're doing after that. We don't have time. Arm strength training. We're gonna do another part of it. That seems to be something pretty common. And we won't have time for it. That was the medical part. If you were here for medicine, you can go directly to the next part of medicine where we're gonna do the presentation. If you stay here, participate in the arm strength training, then it's very honest. We're standing with a stable legs a bit wide apart, and we're breathing in, and we're reaching with the fingertips as far as we can. And again down, reach as far as possible. And now, reach in front as far as possible, and back. And again back and in front. And now fists and circle the wrists. And again back. Hands in front and press the fingertips together. If there's at any time pain at the fingertips, at the fingers or at the wrists, then stop immediately. And have a little bend in the elbow, and also if there's pain in the elbows, then also. And the next exercise. Now with the fingertips. Again, a little bend in the elbows, and if there's at any time pain at the fingers or wrists or somewhere else, then stop immediately. Next exercise. Now take the hand from the bottom of my bed with the fingers into the fingers. Press and lift. Up. The other side. Press. Again, press and go slowly. Press, give slowly in on the other side. Press, give slowly. On the other side, press, give slowly. Round. Press like that, and give slowly in, and like that. So the other way around. And again. And again on the other side. It's wet. Now, one hand out, press, and give slowly in. The other side, press. Slowly in. Again, press. In. Press. And we have shortly time for a few push-ups. So on the ground, hands underneath the shoulders, hands down to the chest, and second, and the third one, and fourth one, elbows close to flip, each, and sixth one, and 7, and 8. Let's do 10. 9, and the last one, number 10. Up again, and one arm in front, shoulder back and down. The other arm in front. Opposite circle in front. And that was the shoulder impingement, the arm stretching. Thank you very much, and until next time.